Losing your job can be a very scary and stressful time. Even if you're thinking about switching jobs in favor of another career, you may be held back for fear of losing your health insurance. But there are coverage options. Hi, my name is Sarah, and I'm here today with iHealth Brokers to discuss everything you need to know about Cobra. Cobra, or the Consolidated Omnibus Reconciliation Act, try saying that 3 times fast, was designed to help workers keep their insurance even after loss of employment. Cobra provides peace of mind to many who suddenly find themselves without insurance provided by their employer. However, Cobra can be daunting, especially those unknowns. With Cobra, your first course of action is to contact HR. If that doesn't work out, you do have other options. You can pursue a short-term health insurance plan. You can enroll in insurance through the marketplace, or you may even be eligible for Medicaid. If you want to learn more about these options, you can check out some of our other videos or just give us a call and we'll be happy to help. If you are going to pursue one of these options, we highly recommend working with a licensed broker. That's a third-party representative who will serve on your behalf to make sure you get the best possible plan at the lowest possible price. And of course, there is no fee when working with a broker. There's no additional charge. If you'd like us to help, you can reach us here at iHealth Brokers at 888-410-0344. We work for you, not the insurance company, and of course we do it at no charge. So let's start by talking about some of the positives of Cobra. Cobra is a way for you to keep your exact same health insurance even after you're no longer employed by your company. In the United States, if an employer has more than 50 full-time employees, they must provide health insurance. Now they do so by contributing to a portion of your monthly premiums, with you being responsible for the remainder. You're probably familiar with this type of group health insurance. Generally speaking, your portion is withdrawn from your paycheck, and that is pre-tax, which lowers your yearly taxable income. With Cobra, there is an absolutely seamless transition because there is no change in your doctor, your spouse's coverage, or your dependent's coverage, which is a really great thing. It's probably the easiest option. Additionally, Cobra coverage begins the day of the qualifying event, and it's retroactive, which means there will be no gap in coverage whatsoever. Some more good news with Cobra is that if you've received health insurance through your employer, you're most likely eligible for Cobra. If your employer offers health insurance to more than 20 full-time employees, they are legally mandated to offer Cobra. If not, they are subject to a tax penalty. You're eligible if you're laid off, if you quit, if your hours are cut back, making you ineligible for health insurance, or even if you're terminated, except in the case of gross misconduct. Now, this would be for something like stealing. Now, you can think of Cobra, or enrolling in Cobra, as a new open enrollment period. During this time, you can change plans, you can add or remove a dependent, etc. And Cobra will cover everything that your previous insurance policy covered. So medical, dental, vision, everything. Something that's very important to note, though, is you do have 60 days from the termination of benefits to enroll in Cobra. Generally speaking, your benefits are extended through the end of the month, even if loss of employment happens at the beginning of the month. So let's say your last day at the job is on the 1st, most likely your benefits will extend through the end of the month, but you want to check with HR in advance because, like I said, you only have 60 days. Additionally, HR has to provide you with a notice of election within 14 days, but it's very important that you stay on top of it because it's in your best interest. Cobra coverage begins the day of the qualifying event and is retroactive. Not only is the coverage retroactive, but the cost is as well, meaning that even if you wait the full 60 days to enroll in Cobra, you're still on the hook for the payment of those 60 days. Generally speaking, you're eligible for a period of 18 months. Sometimes you may be eligible for a period of up to 36 months based on your circumstances. Qualifying circumstances would be enrolling in Medicare, legal separation or divorce, or untimely death. Now you can cancel Cobra at any time. Let's say you've gotten a new job, or you'd like to enroll in insurance through the marketplace during the annual enrollment period, or maybe it's too expensive and you need to forego insurance. Not something we recommend, by the way. Just so you know, cancellation of Cobra or elective cancellation of Cobra does not qualify you for a special enrollment period if you're interested in enrolling in insurance through the marketplace outside the annual enrollment period. However, you may be eligible if your Cobra gets canceled. This can happen in a couple of ways. Let's say you move out of the area and you can't find a provider in that area who accepts your plan. Or if your company goes out of business and is no longer offering health insurance to anyone, they're no longer obligated to offer Cobra. Either of these would trigger a special enrollment period. Of course, your Cobra can also be canceled if you just don't pay. So the negatives of Cobra. One of the biggest drawbacks of Cobra is, of course, the cost. You've probably heard that Cobra can be pretty expensive, and unfortunately, most of the time, that's true. In order to understand where these costs come from, you need to understand how your insurance with your employer worked. So in the United States, if an employer has more than 50 full-time employees, they are required to provide health insurance. In addition, they are required to pay at least 50% of the monthly premiums, leaving you to pay the remainder. Sometimes it even could be less. With Cobra, you're responsible for the same portion that you paid before, plus your employer's portion, and up to a 2% administrative fee. So no matter what, you're pretty much paying at least double what you paid before. So that's where things get pretty expensive. Now, if it's too expensive, you do have other options. As I said earlier, there are short-term health insurance plans, there's insurance through the marketplace, and you may be eligible for Medicaid. So if you need help with any of those, please just feel free to give us a call or leave a comment below. You can reach us at 888-410-0344. The next thing I want to talk about is Cobra and Medicare. Now, when you enroll in Medicare, your Cobra coverage will be automatically terminated, so there's nothing else you need to do. At this point, it's very, very important that you enroll in Medicare Part B, because Cobra is not considered creditable coverage, which means that if you choose to defer Medicare Part B in favor of Cobra, you're going to be charged that late penalty, and that gets tacked onto your monthly premiums. However, if you want to keep Cobra for your spouse or your dependents, you can do so, and they'll be eligible for a period of up to 36 months. That's what I mentioned earlier in the video. I know Cobra and health insurance in general can be pretty confusing, so if you have questions, leave us a note in the comments below, or you can reach us at 888-410-0344. At iHealth Brokers, we're licensed in all 50 states, so no matter where you are, we can help, and of course, there is no charge for our services. If you liked this video, make sure to click like and subscribe as well. Thank you so much, and we'll see you next time.